Just finished this morning meeting. We have a monthly, 2 days I do teaching program, second and third Sunday. That's why I couldn't do it on a morning. Dr. Priya was asking.
Yeah,
Unfortunately, I couldn't do the Mondays morning slot. Sorry for that.
Anyway, it is nice, sir, because the students know they won't get used to that early morning, because they will be telling up to 10 or 11 they will sleep. Today is leave, no? Then only they will wake up. So anyway, 2 o'clock, surely all the students will be alert, so they will attend the program.
Thank you.
Ma'am, it's live now.
Start, ma'am.
Good
afternoon, everyone. Yes, ma'am, I'm starting, ma'am. Good afternoon, everyone. A warm and cordial welcome to the enlightening event, the 14th generic series hosted by R.M.D. Engineering College. On behalf of the Anti-Drug Club of R.M.D. Engineering College, we invite Dr. M. Suresh Kumar, a renowned consultant, psychiatrist, and director of Psymed Hospital, Chennai. He shall be delivering us a talk on the theme substance abuse and use amongst youth, risk, realities, and the road to prevention. As we proceed, let us take a moment to reflect on why we are here. Substance abuse among youth is a growing concern, affecting countless lives and futures. It is not just a personal issue, but a societal challenge that demands awareness, education, and action. Today's session aims to shed light on these pressing concerns and equip us with knowledge to combat them effectively. We are privileged to have Sir with us. And on behalf of the department, I may invite Dr. V. Tamilchelvi, Professor and esteemed Head of the Department of Science and Humanities, R.M.D. Engineering College, to welcome the address. Please, ma'am.
Thank you, madam. A warm and pleasant good afternoon to all. On behalf of our management, principal, and faculty members, I would like to extend my warm welcome to our eminent resource person, Dr. M. Suresh Kumar, consultant psychiatrist, professor of psychiatry, retired from Institute of Mental Health, Madras Medical College and Research Institute, who is the current director and consultant psychiatrist of Psymed Hospital. In spite of his busy schedule, he accepted our invitation to deliver the 14th generic talk series on substance, that is drug use among youth, risk, realities, and the road to prevention. We are privileged to have an esteemed speaker who brings a wealth of experience and insights to this topic. These insights will help us better comprehend the complexities of the issues and guide us towards practical and impactful strategies for prevention. Welcome, sir. It gives me immense pleasure in welcoming each and every one of you to this important talk series on substance use among youth. We are gathered here today to have the insight on the topic that deeply affects our society and the well-being of our younger generation. Substance use among young people is a pervasive and growing concern, impacting not just individuals but families, communities, and the society at large. It is imperative that we address this issue head on with honesty, compassion, and a commitment to finding effective solutions. And substance use is a complex issue that touches the lives of many, whether directly or indirectly. The aim of this series is to shine a light on the causes, consequences, and potential solutions to this pervasive challenge. We believe that through this session, we can equip ourselves with the knowledge needed to support our youth and foster healthier, more resilient communities. It is our hope that this series will spark new ideas and ultimately lead to positive change. Each of us has a role to play in creating a safer, healthier future for our youth. Let us embark on this journey together with hope and determination to make a meaningful impact and pave the way for a brighter future. Thank you.
Thank you, ma'am, for the warm welcome. Moving forward, it is my pleasure to invite Dr. R. Priya, Professor in the Department of Physics, Science and Humanities, to introduce today's distinguished chief guest. Over to you, ma'am.
Madam, unmute.
Thank you, madam. A pleasant afternoon and hearty welcome to all the viewers, and special welcome to the speaker of today's program, Dr. M. Suresh Kumar, former consultant psychiatrist at the Institute of Mental Health and professor of psychiatry at the Madras Medical College, Chennai, India, and also currently director and consultant psychiatrist at Psymed Hospital, Chennai. I feel honored to introduce the speaker to the viewers. Dr. M. Suresh Kumar has extensive involvement in the field of mental health, alcohol, and drug use prevention and treatment as a service provider, teacher, trainer, researcher, and international consultant. He was formerly a consultant psychiatrist at the Institute of Mental Health and professor of psychiatry at the Madras Medical College, Chennai, India. He is former Hubert H. Humphrey Fellow in Substance Use. He obtained Masters in Public Health, that is MPH degree from Johns Hopkins University, USA. He is a consultant for several international agencies, including UN agencies such as WHO, UNODC, and UNAIDS. He held positions on a number of boards and working groups, including being a member of the Strategic and Technical Advisory Committee to the World Health Organization, HIV or AIDS Department, Geneva, and an executive member of the UN Regional Task Force on Injecting Drug Use and HIV. Dr. Kumar has undertaken a range of consultancies in the field of substance use and mental health in several countries such as Afghanistan, Bangladesh, Bhutan, China, Islamic Republic of Iran, Kazakhstan, Laos, Maldives, Mauritius, Malaysia, Myanmar, Nepal, Sri Lanka, Thailand, and Vietnam. He is a part of the editorial board of International Drug Policy and has published articles on substance use, mental health related issues in several peer-reviewed international journals. He has been teaching psychiatry to PG students in psychiatry for 40 years and in addition teaches research methodology to postgraduate students of medicine, dentistry and public health. Currently, he is the advisor, Sanmati Charitable Trust for Mental Health Promotion, lead global R&D, Cities Rise, a global platform for enhancing mental health among youth. Undoubtedly, he is the best choice for today's topic. Risks.
Ma'am, you can continue, ma'am. There was a network lag.
What, ma'am?
Ma'am, there was a network lag, ma'am. The last one line, there was a small network lag. You can just wind up, ma'am.
Yes, ma'am. So undoubtedly, he is the best choice for today's topic, substance use among youths, risks, realities, and the road to prevention. Without further delay, I hand over the session to the speaker. Please, sir.
I hope my slide is visible.
Yes, sir.
Yes, sir.
So, I think it's gone in a different way. Can you just?
Yes, sir.
No, I think the slide is
Visible, sir.
it's gone beyond that. Can I stop and again share it.
Yes.
Yes, sir.
I hope it is visible correctly now. I think the screen has become a little bigger than it can accommodate. Are you able to see the full screen or enlarged one?
Again, it is going beyond the screen, sir.
That's what I'm saying. I didn't understand. It was now.
Now
it's fine,
correct,
sir.
Okay. Okay. First of all, thank you very much for the opportunity to be a speaker at the prestigious R.M.D. Engineering College. My profuse thanks to Dr. Priya, not only for introducing me, for actually coordinating the whole show by talking to me almost every day in the past few days. Thank you, Dr. Priya, for asking me to be here. My sincere thanks to Dr. Tamil Shelvi and Dr. Sudha and other faculty members who are here. And of course, the principal and the faculty members who are organizing this particular program. Today, I'll be just walking you through a very important topic, namely substance use among youth, risks, realities, and the road to prevention. I'm a person who's really not very technologically advanced, but I will try, because I'm addressing to engineering students, use a ChatGPT to produce an illustration for the title. And interestingly, ChatGPT came up with a nice illustration for the title, Substance Use Among Youth, Risk, Realities, and Road to Prevention among students. So I was pretty impressed with the illustration that ChatGPT can actually produce. And it's really thanks to the advanced technology we have at this point in time. So my outline for today's presentation would be, I'll talk about substance use to begin with. And I will actually classify various substances. And I'll talk about the risks and realities associated with addiction. And then the most important topic of road to prevention. And finally, I have some concluding remarks. First and foremost, let me begin by talking about substance use. Often, there is a confusion in the mind of the people when we use a terminology like substance or a psychoactive substance or mind-altering substance. Previously, we used to refer it to drug. And I think when we say drug, psychoactive substance and substance, we really mean the same. Today, the World Health Organization and the American Psychiatric Association prefer the term substance mainly because drugs are generally a term that are broadly used. For example, you have a headache in the morning, you have a migraine, you take a medicine. That is also called as I'm taking a drug to treat my migraine. I'm taking a drug to treat my infection. So sometimes people get confused by the terminology used. So whenever we talk about drugs in the context of addiction, in the context of misuse or abuse, we usually prefer the term substance. So drug abuse, substance abuse, or psychoactive substance abuse all mean the same. We are only talking about the same thing. So I just want to clarify the terminology first. Second, there are all kinds of substances that are available. So typically, the substances vary by the way they act on the brain. Please remember, every substance that we intake acts through the brain. Some of the substances are depressants. They make us feel very depressed. Classical example of a depressive drug is alcohol. A lot of youngsters might think alcohol is a euphoric drug. People get pleasure out of alcohol. Actually, it's the most depressing drug that is available in the world. You see movies, Devadas, Vasanta Malikai, and so many movies. And people, when they are sad, only then they hit the bottle. And when they hit the bottle, they become more depressed. Alcohol does not drown the depression. It actually irrigates the depression because it is a central nervous system depressant. So some drugs are capable of producing depression in the central nervous system. There are other drugs which can actually stimulate the brain, make you a little bit active, concentrate. So these stimulants are becoming very popular among younger people these days. A classical example of a stimulant is a commonly used substance called tobacco. Tobacco is an important stimulant, and all of us use caffeine. Caffeine is a very important example. Morning when we get up, we really want the day to be active. We all consume caffeine. Caffeine is a stimulant. So third one is a drug that can produce some peculiar experiences. Like people can start to see figures, hear voices without they actually existing. These are called as hallucinations. And drugs that produce hallucinations are called as hallucinogens. A classical example of that hallucinogen will be drug called as acid or LSD. So there are different type of substances that are available. Each of the substance have a differing effect on the brain. Let's look at some of the commonly used substances. I think alcohol and tobacco are considered as legal substances. Even though they are legal substances, they are one of the most addictive substances known to mankind. You look at the number of people who consume alcohol in this country itself. It is huge. In the past few decades that we have started to work in this field, I've seen growing epidemic of alcohol use among younger population. And when we grew up as children and college students, fortunately, we didn't even have alcohol available because at that time, there was prohibition in Tamil Nadu. So after lifting of the prohibition during the 70s, I think that's when the flow of alcohol increased in the state. So alcohol is a very strong substance of addiction and quite a number of people are using this drug. Tobacco is another harmful substance which many young people are taking. And tobacco is one of the most addictive substances known to mankind. As Mark Twain observed, this is the easiest habit to give up because I've given it up so many times. So every time you give up, you go back to it, So tobacco is a very compulsively addictive substance. And I think in the past couple of decades, the use of cannabis, what is popularly known as ganja, has grown tremendously in many parts of the country, also in Tamil Nadu. The reason for increase in the use of cannabis is the normative change that has occurred in the population. A lot of young people are believing that cannabis is not harmful, it's not hazardous. It doesn't produce any harmful, impact on the body and the mind. So in that wrong belief, number of people are tending to use cannabis more and more. You do know that cannabis does produce harm. Benzodiazepines and sedatives are called as sleeping pills. These sleeping pills also have become very increasingly abused among younger population. These are usually drugs that are medically prescribed for people with sleep disturbance or with anxiety or sometimes going through emotional distress. These are very useful medications. Unfortunately, these substances can also be used for recreational and other purposes, and then it becomes a substance of not use but misuse and abuse. And then there are younger people, very young people who use solvents in inhalants, glue sniffing, petrol sniffing. These are classical examples. This is primarily concerned to adolescent population. A lot of street children, you ask them, then you will talk about, glue sniffing. Even younger children in school are actually glue sniffing. So this is another problem which is also growing in the recent years. So, but there are certain drugs which are of high concern to all the people because these are extremely addiction-forming substances. Typically, I've spent 4 decades working with people who use opioids. I think the opioids which is extremely popular is the heroin. Heroin is easily manufactured in 2 places. India is sandwiched between them. There's a golden crescent comprising of Iran, Afghanistan, and Pakistan. And there is this golden triangle with Laos, Myanmar, and Cambodia, and I think Thailand. So these golden triangle and golden crescent, India is sandwiched between them. So a lot of heroin also comes into poorest borders of India. So basically heroin is a big problem in the northwest as well as in the northeast. So in Punjab and the northeastern states, heroin is the biggest problem. But fortunately in Tamil Nadu, it's still not a big problem. There are other, like synthetic substances which are medically used. And these opioids are also injected by small number of people. And I think add to it a list of drug called tapentadol, which is actually a tablet. It's a concern that in Tamil Nadu, in the recent days, a lot of people are crushing this tablet of tapentadol and injecting this drug, which is also an opioid. And I think there are other drugs which produce stimulation to the brain. They are called as amphetamine type stimulants. Notable among the amphetamine type stimulants is the methamphetamine. Methamphetamine has become rampantly easily available in Tamil Nadu in the past few years. With the result, a lot of young people are experimenting with methamphetamine. It's one of the most toxic substances known to mankind. It can literally burn the brain in the sense that people who take it suffer from toxicity of the brain. Sometimes they exhibit psychiatric morbidity like overt psychotic behavior. People become boisterous, aggressive, start to hallucinate. And I think people find it very strange. They are very unruly at times, and they have to be hospitalized at times for managing this particular problem. So methamphetamine is emerging as a very important substance of abuse. And many people do not even know the toxicity of the substance when they are using. There are also other drugs which are popular in the stimulant group, drugs like ecstasy, which are most commonly used in parties and rave parties. And I think these can also be causing tremendous amount of harm to young people. I think there is one of the most expensive drugs that is available in India is cocaine. Cocaine is a drug which is more expensive. So not many people can experiment with this compared to methamphetamine, which is cheaper. Cocaine is also a stimulant drug. And cocaine is a drug that could be also abused by richer population. And there are drugs that produce hallucinations, or I call as hallucinogens. And I think a magic mushroom that is available in places like certain places. And I think LSD, psilocybin, these are all the drugs which need not be necessarily used on an everyday basis. A lot of these party goers and other people will experiment with this drug, and then some of them might like the drug and repeat the use of the drug. So let me at least talk about few key substances and what it can do to the body and the brain. First of all, talk about alcohol. I already talked about alcohol being a brain depressant. If you take a small quantity of alcohol, it might help in the beginning, in the very beginning, to help reduce your anxiety. For example, people going to a party for the first time, they consume a small amount of alcohol, suddenly they are socially feeling less disinhibited and inhibited, less inhibited. So they are able to socialize with other people easily. So one of the reasons why alcohol is considered as a socializing drug, because it's the ability to take care of the social inhibition, remove the social inhibition, and make people to relate to each other easily. You can go to a stranger and talk, you go to like superior and talk quite comfortably. That's the reason it's become very popular. But in a little bit more quantity, it can give you a sense of strength. And suddenly you become more talkative, more aggressive, more boisterous. And you can see a lot of young people consuming little larger quantities of alcohol, picking up fights with their own friends, or picking up fights with other people in the shop or in the neighborhood. So it could result in a boisterous behavior. And I think alcohol has a tendency to aggravate and exaggerate the mood. For example, if you're feeling very sad and take alcohol, you're going to become absolutely really lousy. You go to a bar, in a bar, a lot of people are sitting and drinking, and they're not really happy people. And then anybody who sits next to them, they start crying over their shoulders, start telling their sob stories about all the problems that they experience in their life. So it can exacerbate the existing emotions. So most important thing, why we shouldn't be drinking alcohol, because it certainly impairs our judgment and performance. You can't be on alcohol and judge things properly and perform a task properly. You're going to be really miserably failing in your task when you're under the influence of alcohol. One of the things that we really tell people is, do not drive under the influence of alcohol, because your psychomotor skills and the driving skills are greatly impacted by consumption of alcohol. That's one of the reasons we go on the massive drive telling that do not use alcohol and drive. And because it could result not only endangering your own life, you could endanger the people who are on the road. You can hit somebody and kill somebody. If you look at the number of road accidents that are happening in this country, and the association of road accidents to alcohol use is huge. So it's a public health information is that nobody should actually drink and drive. That's a very important thing that we need to carry out very strongly. And I think when you talk about other substances like cannabis, for example, cannabis, there are a number of preparations that are available. Bong is a preparation which is very commonly used in northern India, and also in Holi festival, some of the northernites would use it. Even here, you go to some places in Chennai where a lot of Northernites live. On a holy day, they might give you a sweet that contains bong. Bong is a very, low quantity of tetrahydrocannabinol, which is present in that. Tetrahydrocannabinol is the active ingredient within this cannabis product. Cannabis actually is a herb, and I think this has a chemical ingredient called tetrahydrocannabinol. That is what is mind altering. That is why people take to cannabis. If you take bong, it contains the lowest quantity of tetrahydrocannabinol. It is ingested orally, so it doesn't act immediately. People in northern India usually take this mainly to go and offer their prayers. It is supposed to help them with the concentration and meditation and offer their prayers. But whereas what is really popular across the country among young people is not bong, which is ganja. Ganja is the one which is very, very popular, which is actually dried flowering stem of the plant, and it is available widely across the country. And I think in many, many places, not very difficult to get ganja in the streets. And I think this particular ganja is often put in a cigarette, which is called as a reefer, or it's smoked in a chillum. And this drug can actually produce tremendous amount of impact on the brain. And the other form of cannabis is charas or hashish. And these are all containing high quantity of tetrahydrocannabinol. For example, if you are having a comparison, bong will contain about 2% of tetrahydrocannabinol. Ganja will contain about 5 to 10% of tetrahydrocannabinol. Charas and hashish will have very high quantity of tetrahydrocannabinol, up to 50 to 70%. Whereas hashish oil, which is the most potent variety, will contain even up to 90% tetrahydrocannabinol. So it's very important for youngsters to know what they are smoking. And I think the impact on the mind is greater when they are using substances like charas or hashish oil, which can really impact on their brain and produce deleterious side effects. So cannabis produces a lot of psychological effects. For example, if you just smoke up cannabis, you will be in a dreamy state. Probably the persons fantasize a lot. They will be maybe in a state of euphoria and a well-being and enjoying for a particular period of time, but it invariably is followed by drowsiness. The reason why we say young people shouldn't be engaging themselves with cannabis is a simple reason. That on cannabis, there is an increased tendency to fantasize. Most of the younger adolescents and young people who smoke up cannabis spend a lot of their awake time in fantasies. You as a student is supposed to be concentrating on your studies. Instead, if you smoke up cannabis, you're going to be indulging in a lot of fantasies through the day that will interfere with your attention, concentration, and retention. With the result, your academic performance is bound to come down. One of the biggest concerns for us of young people using cannabis is this. Second, cannabis can also lead to distortions in sensations and perceptions. For example, after smoking up, your time can actually get dilated. Even if they are talking for about 10 minutes with a friend, they'll feel that they've engaged in a conversation for an hour. It also can impair coordination. And I think, imagine you are traveling in an auto where the auto driver has consumed cannabis, which is difficult to find. If it is consumed alcohol, you can smell of alcohol. If he has consumed cannabis, you're not even going to get the smell. And if you don't know what his coordination is going to be. The way he rushes up, the way he speeds up on the road, the way he judges his space could be very intimidating and threatening for us. Perhaps because it's got an impaired coordination. And I think people also have a perceptual intensification when they take cannabis. One of the reasons they enjoy using cannabis is that they say they can listen to music better. It looks like stereo type kind of music, stereo effect is usually appreciated in the music when they consume it. But all this is only temporary. But I think in the longer run, cannabis produces tremendous amount of side effects and deleterious side effects mostly. Okay. Then we talk about cannabis. Some of the people, even on the first time, can experience a negative adverse event. For example, first time users sometimes go through severe restlessness. I've seen number of young people who had consumed cannabis for the first time. It's very important. The set and setting in which they are using the drug is very important. If one college student goes to another college and then suddenly there is a function that's happening, he smokes up cannabis in that setting, suddenly he may feel very restless, fearful, panicky, and say that, the earth is caving in. I'm going to be swallowed by the earth. Something, I'm going to die. Some bad experience is experiencing, usually referred to as a bad trip. The bad trip is sometimes very nice because, that could deter individuals from further use. But some of the people can be reassured of the bad trip and then be told, this is not going to repeat, don't worry, use it again. So that's a sad part of it. So many people can experience bad trip, and the bad trip may be something that they might require some help to deal with that bad trip. So I think, many people, when they use cannabis, they are actually not indulging in very productive, creative activities. They're actually indulging in some meaningless activities. They are not able to control some of this. And I think, so this driven activity that they are doing may be meaningless. And I think it's such a waste of time and resources for a young person who is using the drug. So, and also, it will be very, very different between people who use, other drugs. I think let's talk about, from cannabis, we'll move on to opioids. Opioids also, when they use, the typical opioid I talk about is heroin. Heroin is commonly used. And I think in Tamil Nadu, I think tapentadol use is increasing. Large number of people living in, very poor, areas. I've seen people crushing this tapentadol using. In certain colleges, I've seen reports of tapentadol use. And this is a serious concern for me. So whenever somebody uses opioids are wonderful drugs. Some of them medically used, and they are very important to relieve the pain. Unfortunately, number of the people, young people who are using opioids are not using for a good reason. They are using for a wrong reason. And I think when we use opioids, first of all, I'm just going to use opioid for the first time. I'm not in pain. And I think when I'm not in pain, when I take opioids for the first time, it may produce some unpleasant reaction in me. I may start to throw up, because one of the things that it produces is nausea and vomiting. So I can throw up and I can be in distress. People who have pain and anxiety sometimes feel very good. They feel relieved after taking this, opioids. Those are the people who are going to continue to use again and again because they have some pain, they have some anxiety underlying, and they have taken opioids and they find some relief. And then they say, oh, it's a good drug to take because I had not experienced any pain. I'm feeling very peaceful after taking this drug. So, but then once you become hooked onto it, which is very quick that would happen if you are using heroin, within a short span of time, you become entirely dependent on heroin. You can entirely become dependent on opioids. That's a danger with this drug compared to many other substances. So those who are dependent on opioids, they experience what we call as rush and euphoria. And a dreamlike state can persist in them, which is one of the reasons why they keep on using this drug. What are the substances group that is becoming extremely popular among young people these days is a group of stimulants. Particularly, I'm concerned about the use of methamphetamine because methamphetamine has become widely available. It's cheaper and it is widely sourced in this country. So with the result, one decade back, we didn't have methamphetamine at all. Suddenly in this past decade, there is so much of surge in the methamphetamine use. And this drug could be used by smoking. And after some time, people start to inject this particular drug to get a better kick. So what really happens with this drug, why young people like it, it makes them to have a better mood and better movements. They can dance in a dance floor for hours together without getting tired. And unfortunately, it produces a lot of bodily changes. It increases your heart rate, it increases your breathing rate, it increases your blood pressure, and it makes you completely sleepless. You don't eat at all. People use methamphetamine on a regular basis. They just don't eat. They just eat a very, very small quantity of food every day. They don't sleep at all. Sleep deprivation is one of the things that happen with methamphetamine use. All of us know sleep is integral to our health, both physical and mental. If you don't sleep continuously, your body and mind gets affected. Sleep deprivation also predicts future development of depression and emotional problems. So sleep is so vital. Unfortunately, people taking methamphetamine stay awake for long hours. They don't sleep at all. They have very serious difficulties in sleep. So methamphetamine can also produce very aggressive behavior. So then there are other, like drugs that are commonly used for medical purposes, but they can also be abused by younger people. Notable among them is a sleeping pill, drugs like alprazolam, nitrazepam. All these drugs are mainly used for insomnia, sleep disorder, but they can also be abused by younger people. And I think there are anti-allergy medications like promethazine, which can also be abused by populations. There are pain medications, which again, I mentioned about tapentadol, tramadol. These drugs can also be abused by, younger population. Cough syrups containing codeine. Thankfully, they are banned now in this country in many places. So codeine containing cough syrups can be extremely addictive. And an anesthetic drug called ketamine, which is extremely useful drug, not only in anesthesia, but also in psychiatry to treat, treatment-resistant depression, can also be used by people who have access to it. Now, having talked about the various types of substances like depressants, stimulants, and hallucinogens, and then talking about some of the substances and giving them what it has an impact on the body and mind, let me come to certain terminology which it should be aware of. First of all, a term called use, and how do you differentiate it from hazardous and harmful use, and how do you differentiate it from dependence, addiction, or use disorder. These are interchangeably used. Dependence, use disorder, and addiction. Okay, let me say who are the users. So, if you use a substance and you did not experience much negative consequences, and I think you go to a party, you drink alcohol, you had some good time, and then come back home, nobody found that, and nobody punished you, you got away with that. So you used alcohol. That's use. Use is experience of the substance without undergoing any adverse consequences or negative consequences. So a lot of people may be using substances without negative experiences or adverse experiences. What is a hazardous use? Hazardous use, you can probably know by the way he uses a substance or the type of substance that he's using. If someone is using a heroin, if someone is using methamphetamine, you know that the harm would definitely happen to him one day, very quickly. In a very short span of time, these guys are going to get some harmful effects. Or, the way he's drinking, the way he's smoking, for sure, even though he's not experiencing currently any negative impact, he or she is bound to develop some harmful consequences later. Either he will develop or she will develop dysfunction or it's going to do some harm. So it's almost like a predictive thing, and it is called as a hazardous use. You say the pattern of the use and the type of the use tells me that it is a hazardous use. Then there are people who are actually indulging in what they call as a harmful use, where some damage has been done either to the body or he has developed some psychiatric problem. What about the person who smoked cannabis for the first time, but yet had a very bad experience and he went through an anxiety, he panicked, he felt the world is ending, he's going to die and he has to be taken to a hospital. That's a harmful use. Or what about a person who drank alcohol in a party, large amount of alcohol, and I think he, no drinks he had, and then he landed up next day with a gastritis, and that's a harmful use. So even though here the person is not dependent on the substance, even single time use can actually result in harmful event. Or sometimes multiple use can result in harm to the body or to the brain. This is called as harmful use. Then the important category about which many people are bothered is who are the people who get addicted to a substance, who are the people dependent on the substance, or who are the people who are suffering from a use disorder. These three things are interchangeably used: addiction, dependence, and use disorder. Depends on where you come from and what classificatory system we are following. But addiction today is very important for us to realize. If somebody has become addicted to alcohol or tobacco or any substance, we do know that it is a brain disorder. Addiction is not a character disorder. Addiction is not a moral disorder. People who are addicted to substances, alcohol and tobacco, are not bad people. They are not sad people. They are not mad people. They are not odd people. A lot of them are good people. What they have is a brain disorder. Addiction primarily is a brain disorder because it involves certain circuits in the brain. Substances affect certain circuits in the brain. And these substances affect the reward circuits, motivational circuits, memory circuits, and other related circuits. Because it interferes with these circuits in the brain, there are certain characteristic manifestations which we refer to as addiction. And people who are addicted to substances actually are craving for it, wanting it, and go towards it, either to get the euphoria, a good relief, or they want a relief from the withdrawal symptoms. So they are actually either pursuing a reward or actually taking it to negate a negative experience. So that's how addiction is. Addiction is primarily a brain disorder that involves the brain circuits, which manifests in a particular way, affecting the body, mind, and the soul. Gandhiji called it long time back, alcoholism, as a three-dimensional disease. He was a wise person. Much before science told us, he said, this is a three-dimensional disorder because this affects the body, mind, and the soul. That's precisely what we do know now about addiction. Scientifically speaking, it leads to characteristic symptoms in the body, mind, and spiritual manifestations. So this is addiction. So when we talk about risk for addiction, I think there are a number of factors which are responsible for that. Nobody becomes an addict overnight. It is a process. Over a period of time, people become addicted to substances. There are certain factors which make them vulnerable. One of the most important factor is the biology itself, the genes itself. If my family members had a lot of addiction, I have a tendency to become an addict. And I think the environment to which I belong, whether it is a chaotic home, whether the parental conflicts are there, or whether the peer influence is very negative, whether social norms are accepting alcohol and drug abuse, in those circumstances, it paves way for addiction. And I think early use and availability is a very important reason. And of course, the brain mechanisms are also important in causing addiction. So I'm going to touch each one of them shortly and talk about it. First of all the young people have a tendency to involve in risky behavior. Because when we develop the brain, in the brain development, the reward circuits are developing around the age of 12 to 16. And the connectivity between the control brain, the cortex, and the emotional brain, which is inside, the bridge is also not there. So with the result, these are the people who indulge in risky behavior. People at my age don't take so much of a risk compared to younger people. Younger people involve themselves in many risky behavior. The risky behavior peaks in adolescence. So that is because of the way the brain is developing. There is also a lot of vulnerability for younger people because the brain maturity hasn't obtained completely, which we again talk about now. The brain maturation is not complete when the child is growing into an adolescence. And there are a lot of changes that are taking place in the body, hormonal and other changes. And this is the stage where people at adolescence want to obtain independence. They are not anymore child, they are not adults, but then they think they have to have a control over themselves and they are wanting the greater independence. It's a 16 and 17 who fight for their rights and wanting to be independent. As parents, we all experience that. And then there is also, for younger people, there is greater access to addictive substance than to older people because the availability of substance is targeted to younger people. For example, I started a study long time back in all South Asian countries, Sri Lanka, Nepal, India, Bhutan, and Bangladesh, looked at when do people start alcohol. I was surprised that people started alcohol before the age of 18 in these countries. Today, we repeat it, we find that people are starting alcohol by 14 and 15 in the same countries. So the age at initiation is before the person becomes 18. Even though legally it's not permitted, most people are initiating alcohol before the age of 18. Second, and more important thing is, the peer influence is a very strong factor for using, alcohol, substances, because I do what my friends do. I don't do what my parents do, or my senior people do, or my teachers do. I do what my friends do. Friends influence me a lot. So we call it a peer pressure. Today, peer pressure has become a beer pressure. You go there and then say, oh, drink beer, drink beer. It's nothing, no wrong harm in taking beer. That's what young people are telling other young people. Smoke up. Only then you can be really, great. Nothing wrong in smoking up or nothing wrong in having tobacco. So these are the peer negative influences, and that's what people listen to. So it's very important. People who use substance in a group, large number of people using, they will change the norms in the youth community, and they will make it favorable for people to experiment it the first time. You belong to a group of people, nobody uses substance. Belong to a college where nobody uses substance, it's unlikely that you're going to be initiated to drug or alcohol use. Or as you're studying in a college, you're studying in a group, a group where number of people are using substances, that's when you're going to be initiating and exposing yourself to substance use. Please remember, in the college and school setting, people who don't do well in studies are the ones who are most likely to take, because people will be ridiculed, marginalized, and stigmatized because they're not doing so well in academics. And then they find a solace with other peers who is influencing them and taking drugs. So you need to pay special attention to people who are not academically performing very well relative to others. Also very much dependent on how you take the drug. You smoke the drug, it makes it very easily available to the system. You inject the drug, very, very effectively, efficiently, it's available to the system. So smoking and injecting is much more harmful than ingesting a drug through orally, because there's a powerful rush happens in a very short span of time. That is why a number of substances are being either smoked or being injected. So there are a lot of risk factors. I told about some of the risk factors. I think one of the most important risk factor is the easy availability of substance in the neighborhood. Uncontrolled, unmonitored setting, particularly in the families, is also another important factor. But then we have to also remember there are a lot of protective factors. If you have a protective factor where your families pay attention to you, show affection to you, and accept you completely, attention, affection, acceptance can be a very strong protective factor. If you belong to a peer who are all discouraging drug use, that's going to be very, very powerful. And peers who are academically competent and otherwise socially competent, they have less possibility of using substances. Those who have positive relationships, those who exercise self-control, self-restraint, can be a protective factor. There are norms that are prevalent in our own culture and country. These norms are actually very, very protective for our young people because they discourage substance use. So, but also people with some externalizing behavior, people with attention deficit problem, these are the ones who are going to be getting into substance very quickly. You need to intervene with these unfortunate children with lived experience of attention deficit early on. As I said, one of the most important predictive factor, which is a public health concern, is that those who come from families who have a high degree of addiction, they are likely to become addicted to substances. So I really, really think the important message here is, if you have a family member who's addicted to alcohol and substance, you should be the person who should never touch alcohol and substance, because your chance of becoming an addict is 2 to 8 times bigger than the other person who does not have a family history. So to those families, unfortunate families from which we come from, where there is a substance use disorder or addiction, those people should definitely not start substance use. You start, you're going to stay with this. Pre-existing mental health concerns can also pave a way. Most important among which is, I talked about attention deficit disorder. Untreated attention deficit disorder can pave way for later development of addiction. So early identification and treatment of a child with ADHD will actually prevent the child from becoming addicted. Also, people with anxiety and depression, very common mental health concerns, they believe very strongly alcohol and substances can alleviate anxiety. It can drown depression, which is a false belief. On the contrary, they actually increase anxiety, exacerbate depression, and pave way again for further use. So people shouldn't be using substances when they have a history of anxiety or depression. So the whole process of addiction is not happening overnight. It's a process. It's like you become a graduate. It doesn't happen overnight. You really work hard to become an engineering graduate. People also work very hard to become an addict. Initially, everybody is an experimental user. You talk to people, I'm only a social user, I'm only an experimental user. Then they are starting to use it for recreational and social purposes, weekends, party days, Christmas, Pongal, whatever, Kanam Pongal. So experimental use becomes a recreational use. Then after some time, it becomes a regular use. By regular use, we mean 50% and more of the days. Then after some time, it becomes a compulsive use, which we define as addiction. So this is how addiction progresses itself. I want to underline this particular fact very clearly. When do you know somebody is using? When somebody is actually become addicted to the substance. When somebody likes a substance, you probably know that he's using a drug. When somebody say, I want the drug, that means he's become addicted to the substance. Because a brain change is a paradigm shift from liking a substance to needing a substance or wanting a substance. If you say, I want it, I need it, that means your brain paradigm has shifted. And I think you should be worried. As I said, addiction is a brain disorder that involves circuits of reward, memory, motivation, and control. And this is a very important factor. Please remember, even after, if an addict, sees a drug or exposes himself to a drug, even after several years, his brain can light up and ask for it. So it's a challenging problem. Not exposing oneself to alcohol and substance so important. Once you become an addict, it's very difficult to give up. The road to recovery is not so easy. And the cues can actually make you vulnerable even after several years. And I think drugs produce tremendous amount of adverse health consequences. And I think I can go on say there are many, many health consequences. There are many family-related adverse consequences. A lot of marriages have been broken in this country, domestic violence, family discord, all that happens because of this, or neglect of children. That also happens when somebody is drinking. Social consequences, the productivity, employment, how many young people are not coming to college, they lost their education, absenteeism in college. All this could be attributed to, substance use. And I think legally speaking, many of the substances are also classified as illegal. Obviously, you are indulging in a criminal behavior. And nevertheless, you have to also understand that substance use can also lead to many mental health concerns. Already, we are very worried. The mental health challenges of this country is increasing. Use of substance is going to increase the mental health challenges. There are many number of mental health disorders that can be associated with substance use. Finally, I'm going to be talking a little bit about how do you prevent and intervene with the substance early. The most important message of this presentation is this slide. You have to make sure that the brain is developing between the age of 0 to 20. That's when the brain is maturing. And I think the most important critical period for substance use is the age of 14, around 14. If you expose yourself to any substance around that age, it's going to be extremely detrimental because that early use will be predictive of future use. If you know a young person who's beginning to use tobacco or cannabis or alcohol around 14, which means, it could be 14, 15, 16, for sure that's a person who's going to use substances in future. So delaying the onset of substance use is a very important public health message. If people don't use substance at all till the age of 20, then I think you're doing a lot of service to your brain because you probably are going to escape from addiction. If somebody is going to use it before that, you can be more or less say that one would be becoming addicted to the substance is experimenting, which is going to be very true for other addictions also. You'll realize that mobile addiction, other addictions will also be applicable to this. So early use is predictive of future use. This is something we want to remember. So there are many control strategies that are available. What the police do is the supply reduction. They make sure that the supply is not there, but that's very difficult to do. Demand reduction is reducing the demand by the younger people. That's what we are doing. We want young people, not to demand for substances. When there is no demand, there will be no need for people to use it. There is also another concept called harm reduction, where for people who are using substances, the idea is very difficult for them to give up. It's very true for drugs like opioids, where you say, even if you cannot give up the drug, at least do something to reduce your harm. I think lastly, as really important members of the community, whether it's the college ecosystem or in the community ecosystem, is, I think Dr. Tamil Shelvi was talking about this, is everybody's responsibility to prevent substance use. We can't say this only is the responsibility of the government or the school authorities or the college authorities. It is the business of every single citizen in this country. All of us have a role. First of all, we need to build awareness among young people about the evil consequences, the negative consequences of substance use, what it really does by actual factual information, not by just intimidating information that you're not going to believe. They'll figure out very quickly what they're propagating is not true. So factual information about substances, what they can do, what they cannot do is very important. And I think awareness building will become more relevant if not experts like me talk to young people, if young people talk to other young people about it, because they are most likely to listen to other peers rather than experts and professionals taking about it. Second, I think we all have to be self-efficacious. If you know how to control your life, if you can exercise control your life, if you believe in yourself, if you love yourself, if you're compassionate about yourself, you're certainly not going to take substances because you know that it's very harmful. You do not harm yourself. So drug use resistance can come in people who are self-efficacious, who believe in themselves, who love themselves, who take care of themselves. I think the most important thing is in any campus or any community, we have to build peer norms. How about wearing a t-shirt and saying that I'm very proud because I don't use substances? I'm really, think such kind of messages will be very impactful for younger people. When younger people say it's not cool to do drugs, it's cool to stay off and be sober. And that kind of messages build positive peer norms. And I think if you consider drugs as an activity which should be condoned, should be completely condemned, and I think we have to promote pro-social activities. The good alternative for substance use is pro-social activities. There's nothing better than sports and exercise. I think if you indulge in physical exercise every day, if you do participate in any sports of any kind, that's going to be an extremely important protective factor. And I think we need to improve communication between families. A lot of the substance users feel neglected in their families. People have said, there is no discipline in my family, there is no control in my family, there is no parental, conflict in our family. I think these are some of the things that are happening, which is the reason why I'm taking to drugs. Children are often the biopsy of the family. So facilitating parental engagement, every parent should know what the children is doing, and they should pay attention, affection, acceptance to them. And they should also be, exercising, discipline in a proper way. I believe if you can intervene early with school and college students and community members, we can actually promote pro-social behavior among them. I talked a lot about how to improve family bonding, which will be one of the important preventive factors. All our prevention programs should come to schools, colleges, and to communities. And I think you need to also remember, sometimes we have to reduce the demand of substances by targeting people who are engaged with substance use. We can't ignore them. While on one hand, you have to prevent people from getting onto substances, those who already gone on to substance use, don't want them to progress further. So early interventions are required for people who are experimenting with drugs, who are using drugs recreationally, who are beginning to use drugs regularly. These people require early intervention. You can't allow them to progress, become addicts, and then seek treatment. So intervening with them before they become addicts is also very important. Remember, simple thing, if you are in a community, you are working in a community, you are belonging to a community, you are belonging to a college ecosystem, you can quickly screen for substance use of any kind by simple 4 questionnaires. This is called as a cage questionnaire. Try and employ it among all the people that you know of and ask them simply, have you ever been advised to cut down the substance? Whether it's tobacco, alcohol, any substance. Have you been advised to cut down? And has anybody told you, has your friend told you, hey, you're smoking a lot, please cut down? Has anybody told you that? So have you been advised to cut down? Have you got annoyed at other people when they asked about your substance use? If a friend came and asked you, hey, why are you drinking like this? Don't you think that should be, doing something about it? Is the person getting annoyed? That's a very important one. Does the person who uses the substance become very guilty? I don't know, maybe I'm not doing the right thing. I'm not doing well in academics. I'm actually failing. My parents have invested so much on me. They're sending money from Tanjavur for me to study here. I'm doing this. Is he feeling guilty? Or has anybody used the substance in the morning? Has he used some drugs? Or is she used the drug in the morning? So any of the answer, any one answer, yes, denotes that you require attention to this person. And I think, remember, change, when we want to change a person, the change does not happen overnight, because most people who are taking substances are not even thinking about stopping. The first thing is you have to move them from pre-contemplation to contemplation, which means they have to begin to think about stopping. That itself is a very important step. That comes with awareness. That comes with knowledge. That comes with the knowledge that it is hurting them. Then they have to prepare themselves to stop. And the preparation is another journey that they need to take. Then they decide one day, I need to take the action, I need to take help, I'm going to stop it. And then it's not enough to stop. You need to stop and stay stopped. It's easy to quit, but it's easy to follow back on it. So action initiated then should be maintained. And some of the people, after a period of maintenance, can actually relapse, and then the whole cycle repeats itself. Please remember, it's a circle. Often, journey out of addiction is walking up a down-going escalator, or walking through a jungle about which you don't know where the, destiny is. But it is possible for people to come out of it with all possible help from everybody. So I want to conclude by stating that, as everybody in the introductory remarks said, substance use is a growing problem of the youth. Primarily, it is a youth population which are afflicted by substance use. And I do believe we need to take away the stigma relating to addiction by propagating the message that addiction is not a character disorder. It's not a moral disorder. People with addiction should not be disowned and stigmatized. In fact, they should be treated with compassion and empathy, because addiction is indeed a brain disorder. These unfortunate individuals who are having a three-dimensional disease of body, mind, and soul should be treated effectively by people. Thirdly, preventing is extremely important. For prevention, the most important message is you have to prevent the first use of substance. Because the first use of substance that happens around the age of 14 can be critical in paving way for future use. So educating school children, educating all children below the age of 20, saying that always do not use substances. Even if you plan to do it, defer it now. This is not the age, because the brain is not yet matured. That's an important public health knowledge you need to give to them. For those people who are suffering from adverse consequences, you need to save their lives. Even if they are not prepared to give up substance overnight, you need to indulge in what we call as harm reduction, reduce adverse consequences associated with substance use, treat it. And I think what we really need to do is what Dr. Tamil Selvi said, is everyone's business. Addiction is not somebody's business, it's everyone's business. Every person is involved in it. All of us can do something to prevent this malady among young people. Thank you so much for the opportunity.
Thank you, sir. I think definitely this was one of the best sessions ever. Such an enlightening and thought-provoking address, sir. We are so happy to have you here, sir. And I am basically a chemist, sir. I'm from chemistry background. We've been learning a subject called pharmaceutical chemistry when I was in UG. I got reminded of all the drugs that we've been studying. And it's really very nice of you to hear it from the basics onwards, sir. I believe all students would have listened to your session and they would have got a lot of information regarding the same. Sir, can I have one small question, sir?
Please, please.
Sir, actually, we talk about euthanasia, no? Sir, like it's about mercy killing, sir. This 24-hour drug, this has always drawn my attention, sir. Like, though it is not legal in India, this 24-hour giving a drug to a patient and killing them with the consent of the full family and all that. What is your opinion on this, sir?
I think euthanasia, as you rightly said, is not legal in this country.
Yes, sir. Yes, sir.
But so whatever I express would not be applicable to any particular case. Even if I have a completely different opinion about it, I cannot exercise that option because it's not legally permissible to any doctor. In fact, I do this, I'll be punishable under law because I'm actually committing a crime of, doing a crime of murder, with assistance from family members. Just because I'm a doctor, it does not give me a license to, kill the person. At the moment, the laws are. But look at it the other way. There are a number of people who are chronically ill and with extreme suffering and extreme distress. And the quality of life of them is absolutely meaningless. The individual is having a extraordinary distress because you are keeping him alive, right? Just keeping him alive by life support systems. Often in countries where there is no robust public health system, the pay of the pay for the services belongs to the individual and the family. So often the family is financially completely drained, leaving everybody in the street almost, right? In a situation like this, honestly, every honest question that would be coming to our mind is it right to keep the person alive, knowing fully well he's not going to have any productive life, any quality of life, and at the moment science does not give us any hope for this person. There is no hope for this person. When the family members are completely exacerbated, I as an individual might think of it in a very different way. I read a lot about ethics and all that, but I think ethics is a very fundamental issue. But here, I think you need to consider it in a very wider form. That is why some of the developed countries, but I think the challenge is, the worry is, how will it get translated practically? And I don't think that it should be used liberally. There should be a control mechanisms by which, you make sure that the decision taken by an individual doctor is not just good enough. It should be by a panel of doctors who come together along with the family and the individual decided. Then I think the chances of doing a mistake reduces. One individual doctor takes, that's what happens in many cases, I have the liberty to kill people and then people come and beg me because they pay me a fees and I will do this. That's not going to be helpful. But look at the other way around. I believe very strongly, even though I talk about substance use as a dangerous, thing for the youth, but there is also these substances, you as a chemist know, many of the substances are also useful medically. Particularly, you talk about opioids. I think one part of the country, we talk about opioid use as a very big problem, public health problem in Punjab and other places. The same opioid is a crisis medicine, emergency medicine, life-saving medicine. If you have an acute pain, the only thing that can relieve you of the pain is an opioid because it's the queen of the analgesics. What about somebody who's having an intractable cancer? Imagine a head and neck cancer, and the person is going through an intractable pain. Do I want not to give an opioid to that person? So medically, we need to give opioids to that person. And I think opioids will relieve the person of the pain. Even the person says, I become addicted to this, you have to keep giving me for, several more months and years. I have no problem in doing that. Because I'm not making a person to get addicted to the substance. I am relieving of pain. The fundamental duty of any human being is to make sure the other person does not suffer from pain, right? And it is an intractable disorder. So I think these substances can also be medically useful in very specific conditions because we don't want people to be in pain, in distress forever. Same thing applies to some of the psychotropic medications, which are addiction forming. When people come up with the lived experience of depression and anxiety, when I prescribe, a lot of people, families will ask, why are you giving a medicine which can be potentially addictive to them? Which the answer to that is the harms that come out of the medicine is much less than the benefits that come out of it. It is the harm-benefit ratio you weigh and then you decide. These are very difficult ethical questions, Dr. Shubha. You are actually making me to open up a very big Pandora box. I think we should have a separate session on, about how, people, it's a societal. Ultimately, it's not the doctor who decides. Ultimately, what the society wants to those people. If a large number of societal people want, I don't think family members go through this kind of a suffering. We should put an end to it. That's when people will listen to it. Not when doctors say, not when few people say. As a society, I think in the countries where euthanasia is approved, a lot of people have asked this. How do we support it? Why should we go through this agony? Imagine a country like India, where most people have to go through a private sector for their care. How much it's going to cost for people? Over whole lifetime savings will be robbed off with few days of hospitalization. That's how expensive these days medical expenses are. Unless you are totally trusting the public health hospital, then you are safe.
Thank you, doctor, for making it so crystal clear. Actually, it was of curiosity I wanted to ask that question. But anyway, sir, you made it perfectly agreeable. Absolutely, it was full of ethics that you supported the answer with. Thank you so much, sir, for patiently answering to my question.
Thank you.
Priya ma'am, can we wind up, ma'am?
Yes, madam.
Ma'am, I think
Yes.
Thanks.
Amuda is ready.
Yes, ma'am. Yes, ma'am.
Yeah.
Yes, ma'am. As we near the conclusion of this inspiring session, it is time for us to express our heartfelt gratitude I now invite Dr. K. Amuda, Associate Professor in the Department of Physics, to deliver the oath of thanks. Please, ma'am.
Okay, Subhama. Thank you is such a prayer that cannot be touched or seen. It must be felt by heart. Let me first thank Almighty for making today's occasion a resounding success. Also, I would like to take this opportunity to put all my gratitude into words to thank our management for their unwavering support and guidance throughout this event. Your vision and leadership has been instrumental in making this event a reality. As we draw the curtains on today's enlightening talk on substance drug use among youth, risk, realities, and the road to prevention as a part of our generic talk series, I stand before you with a heart full of gratitude and appreciation. First and foremost, I extend my heartfelt thanks to our distinguished speaker, Dr. M. Suresh Kumar, for sharing valuable insights and expertise with us. Sir, your talk was truly enlightening and thought-provoking. Your insights into the risk and realities of substance use among youth were truly eye-opening, and your suggestions for preventions were both practical and inspiring. Your dedication to the field of psychiatry and your passion for creating awareness about the importance of mental health are truly commendable. Your talk has not only educated us, also motivated us to take actions and to make a positive impact in our communities. Once again, thank you for sharing your knowledge and expertise with us. We are grateful for your contribution to our generic talk series and look forward to future collaborations. I especially would like to extend my profound gratitude to our principal, Dr. N. Anbuchelyan, our dean, Dr. K.K. Tyagarajan, for their moral support and constant guidance. My heartfelt thanks to our beloved head of the department, Professor Dr. V. Tamilchelvi, for her constant help and guidance that radiated a source of energy within us. I would like to place my heartfelt thanks to Dr. R. Priya, Professor of Physics Department, for their efforts towards organizing this event with appreciating ideas. I mention my sincere sense of gratitude to Dr. Subba for her support. Last but not the least, I would like to thank the audience of today's function, all the first year students and their parents for their active participation. I sincerely apologize if I missed out on anybody. Once again, thank you all for your attention. Thank you so much.
Thank you, ma'am. Thank you.
Thank you.
Thank you, ma'am.
Thank you.